Let's talk about the circle system. Here's a completely anatomically accurate patient with all the vital organs drawn in perfect detail. We've intubated the patient, and now we need to figure out how best to help them breathe using a breathing system. The simplest option would just be a tube with fresh gas delivered at the other end. Fine, patient breathes in, lungs expand. But there's a problem when the patient tries to breathe out, because all of their CO2-rich expired gas collects in the tube, meaning they'll breathe it all in again. There will also be a big surge in pressure as they fight the fresh gas flow when they exhale. So let's add an adjustable pressure limiting or APL valve to allow these exhaust gases to escape and to reduce the pressure. And while we're at it, we'll add a reservoir bag. This stores fresh gas so that when the patient inhales, if the flow of their inhalation exceeds the fresh gas flow, the system doesn't limit their breathing. But what if we had two limbs, an inspiratory and an expiratory limb, with valves to ensure the gas only travels one way? We still have our APL valve and our reservoir bag, and the fresh gas flow joins the circle here. Now clearly this means CO2 is also going to be inhaled over and over again, so a circle system has a CO2 absorber such as soda lime to prevent rebreathing. And finally we add in our ventilator for mandatory positive pressure ventilation, and we've got our circle system. The main benefit of the circle system is that it allows for very low fresh gas flows, making it very efficient, because the gases within the circle are allowed to cycle round and round for multiple breaths. The cons are that it's a rather complex system to use, and of course it needs CO2 absorption built in.